timing has to be carefully considered, just because we don't want to get backside of the curve just to have the curve shoot back up again and us have to start all over with this stay at home and shelter in place situation we have currently going.
If I can add a little bit more to that, I recently shared this document with our city and county leaders. This is a roadmap to reopening. This is obviously written by a lot of people who are front line in the field. And this basically goes through line by line what the different phases are of what we should consider when we do reopen. So the first one is to slow the spread. That's the phase we are in now. Next will be reopening state by state. This is obviously for the entire US, but it talks about how the differences in different states and where the curve is in different places affects reopening. And the third phase is to have a vaccine available, basically. And the last phase is to prepare for the next pandemic that could possibly hit us. So this paper right here by the American Enterprise Institute, it's called A Roadmap to Reopening. And this the city and the county leadership. And hopefully they will be using this to try to make decisions for us locally as well.
And for MCH, can you talk a little bit about that 30-year-old's underlying conditions?
No, really at this point, we're not going to talk about specific patient information other than that she does have underlying conditions.
Okay. And I've read in the Wall Street Journal that there may be a link between like high blood pressure and cardiovascular issues and coronavirus. Can anyone speak on that?
Dr. Saravana, do you want to address it?
Yeah, one more time, Michael, please.
Oh yeah, I was asking about, I read in the newspaper that there is a link between cardiovascular issues, you know, with COVID-19 patients and risks for those with high blood pressure as well.
Yes, it's not just cardiovascular risk factors, it's multiple risk factors, respiratory risk factors being the worst of all the risk factors, but there are cardiovascular abnormalities that happen in the COVID disease. To explain it in the simplest way possible, the virus itself causes damage to certain cells in the body. Okay, that's one way damage happens. But the second, which is probably the bigger type of issue that critical patients have, is the storm of the body's response to this virus. And we call it cytokines. It's a type of mediator for immunity. And you get a storm of cytokines in your body. And that storm is what really affects different organs in the body. The heart being one of them, and there's a type of cardiomyopathy that happens in COVID patients specifically related to this cytokine storm. And so if you have underlying cardiac risk factors, to your question earlier, the cardiomyopathy, which is a pathology with your heart because of the cytokines, would be exaggerated. And probably that is what you're reading.
Right, thanks. And I had a couple for the health department. As well. Tell us what recovered means. What does someone have to do to be considered recovered?
So they have to go a certain time period. We can have our health authority explain it to y'all. This is Dr. Janaidu, the county health authority.
Good afternoon. This is Dr. Janaidu. I'm the health authority for Echd County. Once the patient becomes ill, confirmed, and has symptoms, of course, one of the things we look for is lack of symptoms. Then, of course, we look at timeline as to whether or not it has passed the incubation or infectious period. Then the patient, of course, the total health status of the patient dictates recovery. And putting all that together, once that time has passed, patient is not having any other symptoms and feeling, well enough, even though we do not have, and we're not testing for convalescent titers or active titers at this point, we take that on the symptomatic, level.
Okay, and does that patient have to do 2 consecutive negatives before they're considered recovered?
Well, we would like to have like 24 hours apart, that, I mean, 24 to 48 hours apart, that will give us that level of confidence. But bearing the ability to do that, we take the person, at the level of where they are from, from a health point of view.
And is there Dale Childers there by chance?
Yes.
Oh, Mr. Childers, I just had a question for you. Tomorrow, during the county commissioners meeting, on the agenda, it said there's going to be a discussion about a hiring freeze for Echd County departments. Does that include the sheriff's office and the health department?
No, there's exemptions to that hiring freeze. Obviously, law enforcement is exempt, as is the health department, and I think our IT department also.
Okay, thank you.
Critical functions. Yep.
All right.
You good, Mike?
I'm good, thank you.
All right, Mitch, Marfa Public Radio, you're up next.
Hey, this is for the hospitals. I was curious, of the COVID patients in your care right now, are there any that aren't Echd County residents?
Medical Center currently doesn't have any non-Echd County residents in-house. While we have, they've already been discharged home and they're recovering through their county's quarantine process.
And as of right now, ORMC does not either.
And have the hospitals been seeing an increase in patients from other counties exhibiting symptoms of the coronavirus?
No, Mitch, we have not, although you do realize this is a partnership and we are the tertiary care sites for a lot of our outlying hospitals. So we expect them to depend on us, and they do expect to depend on us to be able to take care of those very critically ill. The goal is not to transfer every coronavirus patient here, but the goal is to be able to provide that higher level of care if they need it and they're unable to do it at their facility.
Oh, of course. And
Mitch, I agree with that. We're hosting a weekly call with all the regional facilities. Every Thursday we're doing that. And so far it seems like our regional folks are being able to hold their own right now. Our conversations are centered more around mask volumes, how they're doing on their mask levels, how their respirator levels are. But it seems like right now our partners in the region are doing a very good job of being able to maintain what they have in their communities.
well, I guess, are your partners seeing like an increase though? Like, is a growing amount of reports?
Yeah, I don't want to give us any bad luck, but right now it seems like our remote location is playing into our favor right now because we're still on it's pretty steady. From what we're hearing out in the region, that everybody's pretty much holding steady. So it seems like it's okay right now.
That's great. Concerning the 30-year-old who passed away, I'm curious, what does this teach us about who should stay home to recover and who should actually go to the hospital? Could she have come in earlier and that may have turned the tide on her treatment?
I think anytime a patient can get to us sooner than later, the better it is. However, it's really hard to determine that in this young lady's instance. I think pre-existing conditions also contribute to that. So following those CDC guidelines of if you do have underlying conditions or you're high risk or you're greater than 65, there are certain conditions that really do need to be more aware and staying at home and taking those extra precautions. But having whether they get here faster or slower, I mean, anytime we see a patient faster, treat them quicker. However, it doesn't always play into the success or the outcome of that patient.
I guess, what are signs and symptoms for people recovering at home? What should they look out for signs that they should go to the hospital?
If they're having difficulty breathing, any increased shortness of breath, anything regarding those types of things, I would really encourage someone to come to our emergency room. It's better to be seen than to just stay at home and try to work through that.
And Dr. Janaidu can also elaborate on that if you would like.
Oh yeah, please.
Again, so, this is Dr. Janaidu again. This is kind of situation where you know your body and you know how your body reacts every day. If you start feeling different and you have exposure or you have situation where you have traveled, that's an opportunity for you to quickly at least call your provider, let that person know before you start getting worse. But like that has been said earlier, if you have an underlying issue, it even weighs in more. And that's the reason why you have to really keep a very close watch of yourself and your body, in addition to whatever other histories that might pertain to your situation.
Thank you, doctor. And I have a question for Brandy, actually, real quick. Brandy, since so much of the Permian Basin's oil industry uses transient workforce, how are you defining an Echd County resident?
We go by their address. So whenever we get those cases in, we see where they reside, and that's how we consider if they're Echd County residents.
And concerning community hotspots, is there concern that the public health department may be missing hotspots that may have been brought on by workers who live in other counties or whose address may be in other parts of the state but have been at a grocery store before when they were found to be infected or something like that?
Okay, we'll let Dr. Janaidu discuss that.
Good afternoon again. This is Dr. Janaidu. Let me preface this by the fact that public health does this type of situation every day, long before coronavirus. In other words, we might get a reportable disease under public health status, and we find out the person works here, but lives somewhere else, especially the one you referenced, like an oil worker that may have come into our county. We will take that information. If that person is there, we'll treat that person, but we'll report that as an out-of-county resident. In other words, we'll call the county of residence of that person, especially if there has to be a contact tracing or some kind of more detailed information. So we've been doing this long before coronavirus, and this is the bread and butter of our public health investigation.
I guess my concern is that, I think last week it was brought up the Echd worker on the west side of ODESSA, who may not have been a county resident but did work at that Echd confirmed tested positive. That spot hasn't appeared on your website, and there hasn't been like a range of when people could have been exposed to that worker. So I'm wondering, when will that information be put on your website, especially when the person who is tested positive isn't an Echd County resident?
So we have actively been looking into that Echd resident, and there is no positive employees as of right now that work at Echd. We have confirmed that.